Hello everyone and welcome back to my channel PharmaApex Tutorial. Today we'll discuss part 2 of chapter 1, which is historical background and development of profession of pharmacy from unit 1. So let's discuss. So let's start with pharmacy as a career. So pharmacist and the job of opportunities and working areas of pharmacist are divided into three parts, which is pharmacist practice setting, industry and other settings. So first we'll discuss about practice setting, which is divided into four parts, that is community pharmacy, hospital pharmacy, clinical pharmacy and veterinary pharmacy, that is a pharmacist can work into these four sections of pharmacy. So first we'll discuss about community pharmacy. What is community pharmacy is, community pharmacy refers to the branch of pharmacy practice that involves providing pharmaceutical services and healthcare products directly to patient within community setting. Next is hospital pharmacy. Hospital pharmacy refers to the branch of pharmacy practice that is integrated into the healthcare system within a hospital or medical facility. Hospital pharmacists work closely with healthcare professions including physicians, nurses and other medical staffs. Next is clinical pharmacy. Clinical pharmacy is a specialized field within pharmacy practice that focuses on the direct practice care aspects of medication therapy management. Next is veterinary pharmacy. Veterinary pharmacy is a specialized area of pharmacy practice that focuses on compounding, dispensing and management of medication specially for animals. Veterinary pharmacists work in collaboration with veterinarians to ensure the safe and effective use of medication in veterinary medicines. Before moving forward, I would like to suggest you to write down your notes with me so that you will be ready with your own notes at the end of the video. Next part is industry, where it is divided into 7 parts, which is production, quality assurance, R&D, that is research and development, quality control, packaging, regulatory and sales and marketing. So let's discuss production in pharmacy. It refers to process of manufacturing pharmaceutical products including medications, vaccine, sterile preparation and other healthcare related products. This process involves the preparation, compounding, packaging, labeling, etc. Next is quality assurance. In pharmacy, it refers to the systematic process of ensuring that pharmaceutical products, service and process meets established standards of quality, safety, efficacy and regulatory compliance. Next is R&D, where it is divided into two parts, bulk drugs and then is formulation. Next is quality control. Next is regulatory. In regulatory, there are regulatory affairs in pharmacy, which refers to the field responsible for ensuring compliance with laws, regulations, guidelines and standard governing in pharmaceutical industries. Next is sales and marketing. The sales and marketing of pharmaceutical products involve promotion and distributing medication to healthcare providers, pharmacies and consumers. Here there are some key aspects of sales and marketing. So they have to promote the product, advertise the product, branding of the product, market research of the product, regulatory compliance, distribution channels of the product, then educational programs and post marketing support. Post marketing supports comes after the launching of the product. After that, the third part is other settings. Here, here it is divided into academics, clinical research and regulatory. In academics, it is divided into two parts, teaching and research. Then, what is clinical research? Clinical research is it is a specialized field within pharmacy practice which will focus on the direct patient care aspects of medication therapy management. Clinical pharmacists work as a part of interdisciplinary healthcare terms which will collaborate with physicians, nurses and other healthcare professions. Next part is regulatory. Next is types of pharmacy practice area. So it is of three types. It is wholesale pharmacy, industrial pharmacy, pharmacy education. So first we'll discuss wholesale pharmacy. Wholesale pharmacy offers an opportunity to a limited number of pharmacists to run wholesale business of drugs and medicine. The wholesalers serve as an intermediary between manufacturer and retailer. This line is important. Next is industrial pharmacy. Industrial pharmacy is a branch of pharmacy that deals with the development, production, and quality control of drug products for use in the pharmaceutical industry. It involves the application of pharmaceutical science to the design, manufacture, evaluation of the drug product. Next is pharmacy education. As we are seeing that there is a rapid growth into the pharmaceutical industries and expansion of health services in the country, so there is a very steep increase in the number of pharmacy teaching institute in the country. So to fulfill the demand, there is a need of qualified and experienced faculty members. So next part is pharmacopoeias. A pharmacopoeia is an official book published by a government agency or a medical or pharmaceutical industry. It contains information about drug and medicinal product that includes their descriptions, dosages, formulas, manufacturing methods, purity and quality standards. And it is an essential tool for ensuring the safety, efficacy and quality of medicine. So next question is, who uses the pharmacopoeias? So the answer is, the pharmacopoeias are used by the pharmacists, doctors, nurses and other healthcare professions to ensure that the medicines they are using meet the required standards. So pharmacopoeias are divided into three types. It is Indian pharmacopoeia, British pharmacopoeia and USP, that is United States pharmacopoeia. So we'll first discuss about Indian pharmacopoeia, that is known as IP. The Indian Pharmacopoeia is an official book of standard of drug manufactured, sold and consumed in India. It's kind of it's kind of like a rule book to ensure medication safety and quality. It was published by the IPC, that is Indian Pharmacopoeia Commission, and it is an autonomous body under the Ministry of Health and Family Welfare. They sets the standard for drugs including identity, purity, strength, quality and safety. And it is mandatory reference for anyone manufacturing or selling the drug in India. Next is, it ensures the quality and safety of medicine available in India, and it promotes patient safety and public health. Now we'll discuss the list of publication of various edition of IP, that is Indian Pharmacopoeia. So the first edition was published into 1955 and the supplement of first edition was published into 1960. The second edition was published in 1966 and the supplement of the second edition was published in 1975. The third edition has two volumes, that is first addendum and second addendum. The third edition was published into 1985, and the volume 1, that is first addendum, was published into 1989, and the second addendum was published into 1991. Next is fourth edition, which was published in 1996, and the first addendum, that is a volume 1, was published into 2000, and the second addendum was published in 2002. Next is 5th edition, was published into 2007, 6th edition was published into 2010, 7th edition was published into 2014, and 8th edition was published into 2018. So there are the 8th edition complete, which was published in all these years. Next is British Pharmacopoeia. So British Pharmacopoeia is like a guardian of quality of medicine in the UK. It is published every year. It's a rule book that sets the standard of everything from the raw ingredient used in medication to the final pill, syrup and other forms you receive. This comprehensive book lays out the specific requirement like ingredients that is used to manufacture the product, and purity level of the product, testing methods of the material and the final product for every medicine used in the UK. It's like a detailed set of instructions for building a safe and effective medicine. Next is the MHRA, the government agency. It is a government agency act as an overseer, granting license to medicines that meets the BP's strict standards. They also conduct inspections for manufacturing facilities to make sure medicines are produced following the BP's guidelines. Next is United States Pharmacopoeia, that is USP. It is a non-profit organization that sets the standards to make sure medication and other healthcare products are safe and effective. How the USP works? So the USP, for the first step is setting the rule. The USP publishes compendia, like it's a big textbook kind of thing that tells everyone exactly what's in the medicine, how strong it should be and how it should be made. These are the rules everyone has to follow. Then, more than words, they don't just write the rules, they also provide reference standards. Manufacturers can use this to check their own medicine and make sure it's exactly right. Next is Global Guardian. Even though they focus on the US, the USP's work helps all over the world. Many countries use their standards as a guide. Next is keeping up to date, which is an important step. That is, science is always changing, so the USP is constantly updating their rules to reflect the latest discoveries. So that's all about the chapter 1 from unit 1. We'll be discussing the next chapter in the next video. So thank you so much for watching the video, and also like, share and subscribe to my channel, and don't forget to hit the bell icon so that you will never miss out on the latest content. Thank you so much.